Hello and welcome to this lecture. Today we are going to discuss another classification of drug, which are corticosteroids. And the main mechanism of action for corticosteroids are inhibition of phospholipase A2. And the inhibition of phospholipase A2 is important. Why? Because we need to understand that there is important mediator known as arachidonic acid, and actually arachidonic acid is responsible for the synthesis of prostaglandins and leukotrienes. So what happened that by inhibition of phospholipase A2, the production of arachidonic acid stops, and by stopping the production of arachidonic acid, which is abundant in the cell membrane, the synthesis of prostaglandin decrease and leukotrienes decrease, as I mentioned here in this point. So the main task is to that the decrease of prostaglandins and leukotrienes. And what are prostaglandins and leukotrienes? They are important mediators, and that causes bronchoconstriction. So what happened that by inhibition of phospholipase 2, the synthesis of arachidonic acid stops, and then the decrease of the prostaglandin and leukotrienes occur. So the mechanism will work like this, and we mentioned here that decrease of inflammatory cell airways, and these prostaglandin and leukotrienes are the inflammatory mediators. By decreasing the inflammatory mediators, the decrease of the histamine and mast cell stabilization occur. So that's how they work. So the main thing is that they work as an anti-inflammatory. So what happened? The decrease of the capillary permeability and mucosal edema, and then inhibition of antigen antibodies reaction will be occur. How to administer the drug that has been administered is usually through inhalation, such as budesonide, fluticasone, and beclomethasone, that has been given by inhalation using metered dose inhaler. And budesonide is a drug of choice in asthma, having less side effects. We also have orally available drugs such as prednisone and methylprednisolone, and is in the form of injection such as hydrocortisone and dexamethasone. So the main thing that glucocorticoids, they are not bronchodilators. So how they work? They work by decreasing the inflammatory mediators. So their function is like as an anti-inflammatory. Then they mention reduce bronchial inflammation, as I discussed. Then reduce bronchial hyperreactivity to stimuli, as I discussed last time, that bronchial hyperreactivity is very dependent upon which stimulus, whether it occurs because of the pollen or peanut or any stimuli which is not as severe. So it's depend upon that. Have delayed onset of action, and the effect usually attained after 2 to 4 weeks. So it means that the effect will not be occur immediately. It takes time, 2 to 4 weeks, and a maximum action at 9 to 12 months. So it means that asthma, chronic asthma, we are giving these glucocorticoids, not acute asthma. That's the main difference between the beta blockers. That's the main difference between the other classification of drugs that we discussed before, especially the bronchodilators and the corticosteroids. And we also mentioned they are also given as prophylactic medication, or used alone in combination with beta agonist. So either it can be given as prophylactic, or it can be given as alone or in combination with beta agonist. It is effective in allergic, exercise, and antigen or irritant induce asthma. Systemic corticosteroids are reserved for status asthmaticus, and it could be considered in adult or children with having three features. Number one, if someone is using inhaled beta 2 agonist 3 times a week, as we discussed before, that corticosteroids can be given with beta 2 agonist in chronic asthma, and we mentioned the frequency here 3 times a week. So we already mentioned that corticosteroids will be given in those patients that are suffering from chronic asthma having regular frequency. Then symptomatic 3 times per week. Here we also mentioned the frequency 3 times per week or one night per week, which could be occur at night, and we mentioned that nocturnal asthma. The clinical use of glucocorticoids, the inhaled corticoids will be preferred because they have less systemic effects. As we know that corticoids or corticosteroids are having lot of adverse effects. The list of drugs has been given to you here: beclomethasone, budesonide, and then salsonide, flunsolide, fluticasone, mometasone, and triamcinolone. How to memorize the name of the drugs? Again, make some keywords like B for beclomethasone, B for budesonide, C for cyclosonide, then F for flunisolide, F for fluticasone, M for mometasone, and T for triamcinolone. So you can make your own abbreviation with these words, taking the capital word of each medicine. High dose of inhaled steroids may cause adrenal suppression, and we know that corticosteroids, if we're giving from outside to inside, it can suppress your adrenal gland. Why? Because they are synthesized from the adrenal gland. So if we're giving them from outside to inside, then it can suppress the adrenal gland. Therapy is continued for 10 to 12 weeks, then withdrawn to determine more prolonged therapy is needed or not. Then inhaled corticosteroids are not curative. This is the important point, that intermittent use of glucocorticoids is not approved by FDA, as we discussed there before, that they are not meant for intermittent use. They are given for prolonged effect, for long-term use, because these drugs are not curative. They are just managing the symptoms, such as to reduce the inflammatory mediators such as leukotrienes, or act through mast cells stabilizers. So there is a discussion that whether we need to give corticosteroids intermittent or we can give them daily. In clinical practice, the practice for daily inhaled corticosteroids were not common because patient compliance have the issue. So sometimes the doctor prescribe them as intermittent, which is not approved by FDA. So there's a discussion that a debate is still going on. Reminders for the side effects. The key side effect for corticosteroids are adrenal suppression, as discussed before. Then it leads to growth retardation in children. Osteoporosis also occur. Then fluid retention, weight gain, and hypertension occur. Hyperglycemia, susceptible to infections, glaucoma, cataract, fat distribution and wasting of muscles, and psychosis could be occur. So there are a lot of side effects. That is why they are given them as an inhalant to reduce to minimize the side effects. My question to you, that why hyperglycemia occur as a side effects due to corticosteroids? So kindly give me this answer in the discussion board. in your Moodle. So thank you so much for today's lecture.